I am Aria from the Erasmus University Medical Center in Rotterdam, the Netherlands. On behalf of the co-authors, I would like to present you the results of our study, entitled Radiological Imaging and Gastrointestinal Tonometry Add Value in Diagnosis of Chronic Gastrointestinal Ischemia, which will be published in the March edition of Clinical Gastroenterology and Hepatology. The diagnosis of chronic gastrointestinal ischemia remains a clinical challenge. The classic triad of postprandial pain, weight loss, and abdominal bruit only exists in 20% of patients. In addition, the absence of a golden standard diagnostic tool makes it difficult to reliably establish the diagnosis. The current suggested approach for patients clinically suspected of chronic gastrointestinal ischemia includes radiological imaging of the gastrointestinal arteries. This is a CT angiography of a patient clinically suspected of chronic gastrointestinal ischemia with a subtotal occlusion of the celiac trunk, along with an occlusion of the superior mesenteric artery. However, because of the existence of asymptomatic stenosis, a functional testing is suggested to measure the mucosal perfusion. A gastric and jejunal catheter are placed for 24 hours to measure the partial carbon dioxide pressure. An increased partial carbon dioxide pressure indicates mucosal ischemia. However, the diagnostic value of these modalities is unknown. That's why the aim of our study was to assess the diagnostic value of the radiological imaging of the gastrointestinal arteries and gastrointestinal tonometry in diagnosis of chronic gastrointestinal ischemia. For this reason, we prospectively included all patients referred to our center with a clinical suspicion of chronic gastrointestinal ischemia. All these patients underwent a thorough clinical and physical examination. A CT or MR angiography was performed in all these patients for evaluating the gastrointestinal arteries. A significant stenosis was defined as a luminal reduction of more than 70%. In addition, all these patients underwent a 24-hour gastrointestinal tonometry. The results of these modalities was discussed in a multidisciplinary team, which resulted in an expert-based consensus diagnosis of chronic gastrointestinal ischemia. Patients with occluded disease were offered endovascular stent placement or surgery, and patients with non-occlusive disease were offered vasodilation therapy. The definite diagnosis of chronic gastrointestinal ischemia was defined when patients were persistently symptom-free after adequate therapy after a follow-up of at least 12 months. The definite diagnosis of non-ischemia was defined when patients did not encounter ischemia-related morbidity or mortality in the follow-up period. To assess the diagnostic value, 3 models were fitted. Model A included only the clinical features. Model B included the clinical features together with radiological imaging. Model C included the predictors of Model B together with gastrointestinal tonometry. The discriminative ability of the models was assessed with C-statistic. C-statistic indicates to what extent a model can distinguish between a patient with and without chronic gastrointestinal ischemia. The value of C-statistic varies between 0.50 and 1. 0.50 equals to flipping a coin and 1 is perfect fit. The multivariate analysis showed that postprandial pain, weight loss, and abdominal bruit, and a history of cardiovascular disease were the strongest predictors of chronic gastrointestinal ischemia. However, these clinical features together showed a diagnostic value of 0.62. Model B, the results of radiological evaluation was added to clinical features, and this resulted in a C-statistic of 0.81. Model C, the results of tonometry was added to the clinical features and the radiological imaging, and the C-statistic improved to 0.90. As an alternative model, we assessed the value of tonometry to clinical features. This resulted in a C-statistic of 0.88, which approximates the C-statistic of clinical features, radiological imaging, and gastrointestinal tonometry together. In conclusion, the clinical features alone have a low diagnostic value for the correct diagnosis of chronic gastrointestinal ischemia. The addition of radiological imaging and a functional test, or a functional test alone, substantially improved the correct diagnosis of chronic gastrointestinal ischemia. Thank you for your attention.